Hello, everyone, and welcome back to episode 12 of the League Trauma Podcast. Today, we will talk about life as a medical student, importance of mentorship, and tips for how to put yourself ahead of your peers with Nikola Susic. Nikola is a first-year medical student at the University of Miami. He serves on the board of the Serbian American Medical Association, where he is in charge of student relations. Nikola is still early in the process, however, his goal is to become an orthopedic surgeon when he finishes school. Nikola provides us with a wealth of information, so sit back, relax, and enjoy the podcast.
It's obviously like a very complicated story for everybody. I'm like not a person that believes in just one thing, setting the seed, and that whole cascade of events, but more so a culmination of like many life experiences that lead people down these kinds of paths. But yeah, my name's Nikola Susic. I'm from Maryland, now in Miami. I'm at the University of Miami Miller School of Medicine, and I'm a first year right now. And my journey to medicine really started, I guess, when I was young. I'm not sure if you had the book assigned to you, John, when you were like in like middle school, but we were given the book Gifted Hands by Dr. Ben Carson
Yeah, oh yeah.
or Benjamin Carson. Yeah. So that was really like my first exposure to the thought of like even a career in medicine or anything related to, medicine or science. Nobody in my family is a doctor. I have family friends that are doctors, but I really didn't get into like contact with any physicians at a young age or anything. So that, I guess, is sort of my seed for why I wanted to do medicine. And obviously, I've loved science like biology, chemistry, and physics. So all of that sort of played into it as well. But um, probably the biggest thing that impacted me in terms of wanting to really commit to doing medicine as a profession was my experience with my grandmother, who basically took care of me my entire childhood. She ended up having a stroke, and it was sort of just seeing like her in the hospital and seeing the physicians caring for her, everybody on the care team, that really made me like sort of envision that for myself as a career, and it really did make a difference. Like all the speech therapists, everybody along the way played a part in her recovery, and she was able to get somewhat better for a few years before she passed away, unfortunately. But it's those like last few years where we had the time together where she was able to, at one point she wasn't able to really speak, and through the work of like the physicians and everybody on the care team, she was able to regain her ability to speak. And spending time with her during that time and having that like little bit of life given back to her really was valuable for me. So that's in a nutshell the story. But like I said, it's not really one thing, at least in my opinion. There's like so many stories I could tell you, like about patient interactions I've had, different like experiences in my life, my own medical, issues with, torn ACLs and everything like that. That's probably like a common story that you guys have even heard. But yeah.
Yeah, so you mentioned we were texting and you said you kind of want to go into orthopedic surgery, right? That's kind of like the route you're going to take through med school. So we know there's tons of opportunities in the medical field. So how did kind of you narrow it down to that being your final destination as your occupation?
Um, so I'm not going to say 100%. That's definitely what I want to do because I still haven't done clinical rotations. But yeah, orthopedics is definitely up there, especially also with some other surgical specialties. That's really what I'm thinking about right now. But orthopedics is really interesting to me. I mean, just like I've always loved, like even from like working out like as a kid, learning about the different muscles in the body, the different bones. Bones just like look cool on x-rays. And it's really for me the thing that makes orthopedics appealing as a specialty in medicine is the fact that you're actually able to directly impact someone's life like then and there through a surgical intervention or a procedure and almost immediately get that person feeling better. Whereas in some of the other specialties that I'm considering, like for example, neurosurgery, which I'm also still considering as a specialty, there's not as many good outcomes, for the patients. So people will come in, for whatever reason, a brain tumor, or, if you need an operation on your brain, you're usually pretty sick. So that's the same thing with a lot of these surgical specialties is, you're not always going to have the happy ending stories. And in orthopedics, it's more so happy endings than not happy endings.
Yeah, great.
Yeah. And obviously it's cool. I mean, you guys do your thing with the sports injuries and stuff. I've always enjoyed learning about that side of sports as well. And I'm not sure if you know, but I'm a huge fan of like the UFC. So I sort of like love learning about the different parts of the body, and mixed martial arts, obviously, like there's some pretty gruesome injuries there, which it's always interesting to see people's recoveries in the sport, especially like after crazy fractures that they've had. I'm not sure if you saw like Chris Weidman, you know him?
Oh yeah.
Yeah, he has a whole documentary that he just released, and then Conor McGregor's too for his similar injury that he had. So yeah, in a
Cool.
nutshell.
Yeah. I was gonna ask what led you to Miami or University of Miami, and what has that been like? Because I know it's a extremely diverse community with the international community as well. So like what has that been like? What led you down to Miami?
For Miami specifically, so it was, I mean, med school, the whole application process. I'm not sure how it is for physical therapy, but for med school, you really don't get to pick and choose that much for where you're going to end up. And I got really lucky with getting into Miami, and they're a fantastic program, one of like the top 50 med schools in the country. So I was originally planning on staying actually in the local area around Maryland. Ended up getting into Virginia Tech and not getting into like any other schools around the Maryland area. So it was Virginia Tech, which is the closest to Maryland.
Right.
It's about 3.5 hours away, or I had to go somewhere else. And thankfully, I ended up getting into Miami, which was a place that I visited several times before, just like on vacation. And I even wrote exactly about what you said. Like the diversity here in Miami is similar to what we have in Maryland. Like Maryland's very diverse. Here it's diverse in a different way in terms of like the international, people in the communities, but it's, very similar sense in like diversity. And that's really what I wrote about in my like secondary essays. And it's just like a fantastic place. Honestly, I couldn't be happier with like the actual physical location. I mean, what's not nice about, sunshine every day and, nice people, everybody's super friendly. And they really, the medical school here is like very valued amongst the community. Like we do a lot of community outreach. I'm a member of the Department of Community Service, docs here, and we do health fairs in the local communities. We connect patients with like patient navigators who will basically help them find the care that they need if they don't know how to, or having some barriers to getting seen by a doctor. So we do a lot of stuff in the community, and the community treats us with a lot of respect here. Like when I ride the bus, people are always trying to give up their seat for me and stuff. It's really nice. And I just can't say enough good things about the school itself. Uh, it's crazy the opportunities we have, like as medical students, especially first year medical students. I can go into like the OR. I can go, I learned how to do Botox injections today. I've learned how to do like a variety of different procedures, like even had the opportunity to practice some like orthopedic surgery procedures using sawbones, which are basically like fake bones that some of the like residents will use to practice their surgical techniques. So we've had like crazy experiences as first year medical students, and I know other kids at other schools that haven't even gotten to shadow at all yet. And
Yeah,
yeah, it's been awesome.
really cool.
So have you had any interaction with the physical therapy school at Miami?
So sort of in passing, yeah, the physical therapy students, we see them in passing, but we share the same like anatomy lab. So we have physical therapy students there sometimes when we're actually doing our anatomy sessions with some of the donors there, and that's pretty much at most what we've gotten in terms of interactions directly with the students. But the same faculty that teaches us anatomy also teaches a lot of the physical therapy students. So I'm sure that they get a great education too as well. And then I shadowed PM&R, like physical medicine and rehabilitation, and in shadowing them, I didn't really work with physical therapists directly, but I know that they work very closely with physical therapists. So they told me a little bit about some of their experiences and stuff. But definitely going to be working with physical therapists in the future. So probably something I should try and get more hands-on experience with.
Yeah. Are there any, you mentioned like community outreach and you were big in the community. Do you have any like other connections with other students that are in like graduate levels? Like I know we already talked to physical therapy, but like how about like the pharmacy students? I don't even know if there are any, like what are the other graduate level programs at Miami, but do you have any like interprofessional activities with any of the other professions in your school?
Oh yeah. Oh yeah, definitely. So we work in the same building as, or like learn in the same building as the PhD students or graduate students. So a lot of PhDs, a lot of master's students. There's a variety of different like nursing programs. I'm pretty sure there's even nurse practitioner training at Miami. So we have a bunch of different programs at the school in terms of like directly working with the students from those schools. We don't really do too much other than like the occasional mixer. But then again, I'm just a first year. I've only been there for like 5, 6 months now. So maybe in the future. We did do like a mixer with the law school, so we do hang out with the other schools around here as much as we can, of course, when we're not studying.
Right.
Yeah.
Awesome.
That kind of leads into my next question. I was going to ask, how do you balance that work-life balance or school-life balance? Because obviously it's tough. And then you being a medical student, it's got to be extremely tough. How do you cope with that, or how do you find time to do the things that you want to do?
Well, it's definitely like it's been a struggle in terms of getting used to the demands of the schoolwork and a lot of extracurricular activities. So in med school, just doing med school really isn't enough to, especially for orthopedic surgery, which is one of the most competitive specialties you can get into. It's usually like number one or two. So basically, you got to get involved with research. You got to get involved with leadership activities. So sort of balancing all that out, it gets hard sometimes. It's some days are good, some days are harder, but it's really just being consistent that matters the most. Like studying a little bit every day is much better than cramming, the weekend before. And same thing with any like research projects or any other kind of work. Like just a little bit at a time is really the best solution for, managing the workload of medical school. But you always have to take a little bit of time every now and then to, care for yourself. And I mean, I have things that I definitely don't skip on a day-to-day basis. Like I haven't skipped a single day of the gym, for example. So I'm still, keeping active, staying healthy, because, how am I ever going to take care of patients when, you know, you can't take care of yourself. So I always gotta do that, and eating healthy helps, you know, things like that.
Cool.
Yeah, definitely something that Josh and I have been doing better. Once we all both find ourselves kind of not struggling by any means, but we kind of found ourselves very early on that we needed to be consistent in the gym and find things outside of the classroom to have more fun doing the things that we're loving, like school, and then like you mentioned, the gym and coaching and doing other things like Instagram pages on the outside. So that's awesome that you mentioned, and yeah, we can relate for sure. Like first year was a lot of time commitment and a lot of outside of the classroom activities that we had to put forth in front of a few things, but we made sure we always kept the things we love in our schedule.
Yeah, I mean, why don't you tell me a little bit about how physical therapy school is? Like, I honestly don't know too much about it, other than I know that it's hard and rigorous, at least from the knowledge, like the breadth of knowledge that the professors had for that were teaching us anatomy. They held you guys in high regard. So
Yeah,
Yeah.
definitely anatomy heavy first year. And then, I mean, every program does their clinical rotations differently. So we don't have any like residency at the end like you guys, but we have our longer clinical rotations like integrated throughout our program. So for example, we'll have like short 1 week ones early on, like at the end of our first year. And then we just got back from our first full-time one. And then we have 3 more full-time ones, and that'll be it, like in terms of our program. But we have that intertwined with all our didactic work throughout the course of 3 years. But I mean, it's just anatomy heavy, a lot of lab activities, a lot of hands-on stuff, and then the clinical rotation. So
do you guys get any like direct patient interaction as students? Are you able to actually like see patients, you know, like other than shadowing?
yeah,
Or
yeah, that's what I mean. Starting off with our first like 1 week ones, it's a lot of shadowing, but after we get into our full time, so we just got back from our first full time, and like by I mean week 2, I'm sure John Allen was too. We were hands on, like leading the evaluation. Like a lot of times our clinical instructor is like on the other side of the room, and we're just like we're giving that patient direct patient care. So and we take that load on for the remainder of our clinical rotation, and that's how it's going to be for our next one, and then the 2 to follow after that.
Yeah, it's
that's
super
awesome.
super rewarding to kind of just apply what we've been learning in the classroom. It's hard for Josh and I to just sit in that classroom all day and just be lectured at for 8 9 hours a day, and it's just like we're both athletes. We're like all three of us are athletes at one point in our life, and we just like are dying to move and communicate with other people, and it's just like so rewarding to finally get out in the clinic and have that one-on-one care and have freedom and autonomy to actually use all the knowledge that we've been learning and spending a lot of time and effort into in the classroom for. So it's, I mean, that's the best part of PT school for me personally. It's just like, I'm sure Josh agrees with that. It's just like finally we get to be a PT and experience what it's like to be a PT in the occupation we've been studying for our entire life pretty much.
Yeah, I mean, it's physical therapy. It's all movement. So when we're in the classroom all day for 8 hours, 9 hours, it's tough. But when we get out in the clinic and can actually move and get patients to move and just be on our feet, that's what we live for, and that's why we got into this profession. So
That's awesome. And how much of the stuff do you guys do like inpatient versus outpatient, like in your training?
so throughout our program, like we won't be able to pass our boards at the end if we don't know enough inpatient or enough outpatient or even a little bit of sport neuro. Like we have to cover all aspects of that during our didactic coursework. We get to fill out forms in terms of like where we want to go on our clinical rotations. So if you think you're going to be more neuro based or acute care PT, then they'll try to send you out on locations like that. They try to give us at least one in every setting. So I already had a couple like short inpatient ones, and then I just had my first outpatient one. John Allen, I don't think has been in the hospital yet, but at some point he'll get in there for one of his rotations. So they try to give you one so you can at least see it. Maybe you don't think you want to take that route, but at least see it. So you still have that option. So we have to cover it all in terms of like our coursework though, so we can pass our boards. You have to be well rounded as a PT and then break off into your niche after that.
Yeah, and interprofessional activities like we were talking about earlier is like UMES does a great job at getting us connected with the PA program, the pharmacy program, and putting us out in like a 1 day interprofessional activity with maybe a case manager in the ER or like a radiologist in like in that doing X-rays and stuff like that. So like that kind of stuff is invaluable for education, and it's super helpful to actually see what other professionals are doing on a day-to-day basis and get a feel for kind of that aspect when we are communicating with them in the future.
One thing we don't get to do though, which I feel like kind of sucks, like not to talk bad about our program or anything, but we don't really get a chance to watch like a surgery, like an orthopedic surgery. And like for a lot of us that want to get into orthopedics and we're going to be treating these patients post-op, like I think it'd be nice if we were at least given that experience to watch a surgery to see what goes on in the OR, but we don't really get that experience. But I mean, there are opportunities. We can reach out, we can network, we
Yeah,
can
yeah.
connect with people, but just in terms of like our coursework at our program, like it's not included, but
Yeah,
we'll
we'll have
still
to
make
get
it
to
happen.
Miami, see Nikola do some surgery.
Oh, for
Oh
sure.
yeah, yeah. Hopefully, fingers crossed. But
Yeah.
yeah, I would just say reach out. Like a lot of my success that I've had in terms of like getting into the positions where I'm able to go into the OR and other experiences like that have mostly come from me just like cold emailing the doctors and just saying, hey, like I'm really interested in this. I've never had the experience, but I would really want to, learn more about this. And they'll usually have you come join them in the clinic, maybe a few times. And, if you get on their good side, they'll bring you back into the OR and let you stand for a few hours. Yeah. But
Yeah, definitely. I definitely get what you're saying too, in terms of like how competitive orthopedic, like that residency route is, because I have a close cousin he finished med school and now he's like in that waiting process. I think next month he'll find out. Like, and
oh yeah.
he said it's sort of like an NFL draft, how they're just like they just get matched. And when he told me like all the places he applied and interviewed to, it's crazy. It's really just like all over the country. It's like wherever you get, like you're going.
Oh yeah, I was actually we had a residency panel meeting with the head of the Department of Orthopedic Surgery here, and it was crazy when they were saying some of the stats. They get thousands of applicants for 7 positions per year, and then like just to narrow down the number of applicants, they like they won't even look at your application if you have like below a certain like score for your step 2, which is like you basically have to score better than 80% of like all students that take the exam just to even be considered, like for them to even like look at the first page of your application. So it's crazy how competitive it is, but if you want to do it, that's what you got to do.
Right.
You mentioned you're doing like community outreach and all those like opportunities that you're seeking forth individually. Does that have any impact on it, even though you might not maybe get a 75 and then it just doesn't matter all those opportunities? Dang,
At least for Miami, at least from what they were saying, they said that if you don't get a certain score, or I mean, they said, actually, I take that back. They did say if you're from Miami, our med school, they do like take it into consideration if you don't hit all of those benchmarks. But from my understanding, from what they were saying, you pretty much got to meet those certain benchmarks. Otherwise, it's not great chances for to say the least. Yeah.
How can they look through all those applications? It's like if you're not even here, then we can't even waste the time to look at your application because we have thousands of other people to. It's crazy.
Yeah. Yeah. It's definitely like a lot to do, and a lot to worry about for the future, but day at a time sort of thing. If it's meant to be, it's meant to be. And it's sort of like applying to med school. Like the sort of mentality you have to have is, if you really want to do it, you'll get there. And no matter how many tries it takes, or how many failures you have in the meantime, it's all leading to that one road if you really want it. So
Yeah, that's a great point. So I saw in your bio that the Serbian American Medical Association. Now, are you personally involved in that, or is that something you're just like kind of promoting in your Instagram bio?
So I'm technically one of the board members for the Serbian American Medical Association, but more so like involved now with the student outreach portion of it. So what we do is we do a lot of things. We're like nonprofit organization that basically raises funds and gives back to countries within the Balkans, mostly Serbia, but there's a lot of underserved areas there where, they might have one hospital in like 50, 60 miles, So it's, getting them a lot of the care that they need and the resources they need. They have like we renovated one of the hospitals there to actually have room for more beds during the COVID pandemic, got them new beds. They were using beds from like World War I or World War II. It was crazy. So we do projects like that. And then mostly what I'm focused on now in terms of the Serbian American Medical Association is like setting up journal club meetings where residents, like students that are interested in medicine and in science, or really anybody can come and join and like network and interact with each other. And in sort of doing that, maybe find mentors. We're also working on doing a mentorship program, which has been sort of dragging its feet, but the ideal circumstance would be to pair each student with another at a higher level. So for example, if you're in medical school, meeting with a resident, would give you some insight into what are like the next steps to get to where you want to be, or yeah, basically just give opportunities to, those from Serbia and other Balkan countries.
Yeah, that just brings up so many questions, but since we're running out of time here, I'll just start with this. Like, do you have any intention of going, like, practicing in Serbia? Or is it you're all just kind of from here doing a lot of things from the United States?
I honestly, I mean, ideally, I'd like to. I honestly don't know legally what the circumstances are about practicing in other countries, just because it hasn't come up yet. But ideally, yeah. I mean, ideally, if I could go over there and give some free surgeries or teach in Serbia, that's definitely something I'd like to do. I don't know if I'm actually fluent Serbian speaker, but I don't know if I would be able to speak medical terms in Serbian. So I'd probably have to work on that in the meantime. But yeah, definitely something I'm interested in.
How many like I was gonna say, what does it mean to you to represent Serbia and be at a medical school in the United States? Like, does that give you any like extra motivation? Like, I don't know how many other Serbians are in your program, or
I don't think there's any. I think I'm the only one. Um, yeah, I don't know if it does give me motivation, to represent and be a good representation for Serbia. Um, it does really. It's not something I often think about. I have a lot of love for Serbia, and that's pretty much it. Whatever I can do to give back to the Serbian people, my family's from there, and America too. Like, I mean, I'm just thankful, so thankful. It's crazy how I'm even here to begin with, let alone in medical school. Like, my dad won a green card on the lottery, and that's how he came to the US. If he didn't win that lottery, I might have never been born. So that's um that's how crazy that is. But yeah, I do I guess I do take some motivation from being Serbian and wanting to, live up to the expectations that all the Serbians have of me. Yeah.
That's
yeah,
a crazy story.
yeah, it is.
Oh yeah. Yeah. It's pretty crazy. They still do the lottery, by the way. So there's people coming every year. They have a certain amount of green cards that they give away, and you put your name in the lottery, and they draw a name. And my dad got lucky that year, and that's how we came to America.
And you got Nikola Jokic over here dominating the NBA.
Yeah, yeah. It's crazy. Now before him, there was so everybody would say, "Oh, Nikola, like Nikola Tesla," and I would be like, "Yeah." And now more recently, it's changed to, "Oh, Nikola, like Nikola Jokic," and I'm like, "Yeah." Yeah.
That's awesome.
Kind of going off of that, I was gonna ask if you have any like huge or big like role models or mentors that have like helped you throughout your journey, or any newly acquired ones down in Miami or any at College Park. Like, does anybody come to mind when I ask you that?
Ton of people. I mean, nobody gets anywhere in life alone, And if they say they did it all by themselves, it might be stretching the truth a little bit. But I've had a ton of people that have inspired me. I mean, everybody from like Dr. Carson, who I spoke about earlier, who I actually met in person. I had the pleasure of meeting him at one of his charity events, which was a really cool experience. I've had other mentors like Dr. Ricardo Araneta, who I worked under and did research in undergrad. He basically taught me how to be a scientist. And then Dr. Aksentijevic, who's the president of the Serbian American Medical Association and sort of a family friend of mine. He's been really instrumental. I was able to shadow him. He was like one of the first physicians I ever shadowed, and he's a hematologist oncologist. So I got to see sort of the not so happy side of medicine too, and that really helped me confirm like that it is what I want to do with my career. So there's been a ton of people along the way. I mean, nobody I could not enough time to mention all the people who've helped me to this point. And now I'm working with a ton of very impressive, very like fascinating people. So the list goes on and on. But those are just some of the people that have helped me get to where I am today.
So we got about 4:30 left. Do you have any other questions for us, or any like kind of closing remarks that you'd like to say before we hop off?
I mean, one thing I really did want to ask you about is sort of what your relationship is with like the physicians you guys work with, and how like as a orthopedic surgeon or whatever doctor I end up becoming, how I can, sort of bridge the gap between specialties and, make sure that everybody's working together on the same team, and just anything you can comment about that.
Yeah, I think the biggest thing, like specifically with PT, like if you're like the head of the PT department or whatever the clinic, it's your job to kind of reach out to the physician and build that relationship, so the physician is more likely to refer those patients to your clinic. So I think that from your aspect, like there will be a ton of physical therapists coming to you for your referrals, especially as an orthopedic surgeon. Like you will be probably flooded with emails, flooded with like thank you cards and stuff like that. And you will have no problem getting in contact with physical therapists. I can guarantee you that. With bridging the gap, I think a lot of it falls into the physical therapist's hands, but like you just being open to talking to the physical therapist would be a huge help to us and our profession as well, and just getting, like you said, bridging that gap and yeah, getting closer to the physician.
Yeah, I think definitely building the relationship is good. I think if there's anything on your end that you could potentially do in the future, I think being a little bit more detailed in a script that you're going to give to a physical therapist, because I know we'll get sometimes some like really generic scripts and like protocols to follow, but I know generally, I mean, surgeries could be similar, but like every surgery isn't going to be exactly the same. So if you could like make a comment on like how the tissue integrity is like post-op, or like just small little things to like look out for in our treatment, that makes it easier on us than just like kind of following a generic script for every single patient. Just adding like, even if it's a few comments about specific details that occurred within your operation, I think that would help us a lot.
Yeah, one more thing
Cool.
to add is like I know you're very easy to approach, easy person to talk to. Is just remaining that way and allowing the physical therapist to feel comfortable to reach out to you if any complications are arising, and not being like you don't want the PT to be scared to reach out to you if something did, God forbid, did happen in the clinic or outside of the clinic after the surgery. Just remaining like a positive light and a positive relationship for that open communication. Because a lot of people will not communicate if they don't feel like you want them to talk to them, and you aren't like there to help them out. So that's another thing, just being like a person, a people's person, as a surgeon would also be helpful.
Never change. I think that's a good point. It's a really good point because there are other times where my CIs may not reach out to a certain physician because they feel like not like they look down upon them, but it's just like they feel like the communication isn't going to be as great because like this guy is like doing his own thing and he's not going to like respond or it's just establishing that rapport is always important. And then like John Allen said, just remain a people person and being open to like at least hear us out.
Awesome. No, that's all really good advice. I'm definitely gonna do my best to keep true to myself and stay the person I am, and definitely gonna keep that in mind when I'm working with PTs and everybody around me. So thank you for that.
Yeah, that's awesome, man. Well, thank you very much for hopping on. It's been a pleasure. I know I learned a lot. I know Josh learned a ton as well. And like I said, we would love to hop on another podcast maybe someday and talk about orthopedics specifically. And yeah, man, that's all that we have for you. Yeah, we'll be in touch for sure. Thank you again for joining.
Yeah,
Appreciate
awesome.
you.
Thanks for having me. It was really a pleasure, guys. And anytime, just let me know. I'm happy to hop on. Thank you, guys. And keep doing the work you're doing. It's great stuff.